As hospitals around the United States deal with the coronavirus crisis, the fear of infection, drug shortages and strict rules imposed on visitors are now leading more and more women in the United States to consider home births. Expecting mothers must also but weigh in the issues involved. One of the biggest roadblocks, of course, is the cost factor. According to estimates, home births in the U.S. could cost up to $4,000. The largest amount as a part of the process is when it comes to the midwives' fees. Home births are also mostly not covered under the U.S. health insurance nexus. Many hospitals around the country have implemented new anti-infection rules that limit the number of people in the delivery room. In New York, hospitals had barred husbands or partners from being a part of the process or from being in the delivery rooms. This was until the governor, Andrew Cuomo, stepped in and signed a decree stating that no woman had to give birth alone. Let's talk about expecting a mother, Ashley, who is pregnant for the third time after 2 miscarriages. A birth at home, she says, is the only option for her.
Definitely anxiety's up, and that's another part of it, of like why I'm like a bit hesitant to go to a hospital, just because that's where they're taking people, you know, like people are going to be in and out of there. And also, like, I also think about whether or not I would be taking up any resources from, you know what I mean, like these nurses, like I don't know if they work in like multiple areas of the hospital or if they just do it, so they couldn't really promise that like my husband definitely would be able to be there. So that was a little bit like, I was like, oh my gosh, like, because with everything that we had been through, that was like not an option for him to not be there. You know, we've worked our butts off to like get to this point. So I just didn't want to take that chance. So I did talk to a friend who had 2 home births.
Even as expecting mothers consider birth at homes, midwives are struggling to cope up with the sudden boom in terms of the demand for their expertise in home births. Of roughly 12,000 certified midwives in America, only an estimated 3,000 practice outside hospitals. Midwives have also changed the way they work in order to prevent the spread of the infection. This includes cutting down on house calls, seeing patients via online tools and means of video conferencing. In the pre-coronavirus world, only 1% of births in the U.S. took place at home, but most experts believe that the percentage may go up this year. Even as health services reel under the crisis, the American College of Gynecologists maintains that hospitals remain safe to give birth.